All right, well, welcome back, everyone. So we're going to pick up here, and this is going to be a relatively short part, and we're going to talk about how our various hormones, or rather how the hormones receptors respond to the hormones themselves, specifically looking at how they respond to the amount of a given hormone, right, or the concentration of a hormone. So a cell's response, so remember a hormone is acting on a cell via its receptor. So that cell's response to a given hormone is going to vary based on a couple of things. One is the number of receptors of the hormone, and then one, its simultaneous response to other hormones. And we'll talk about different types of effects whenever you have multiple hormones that are acting on a cell. They're either acting together, they may be acting against each other, they may be assisting each other, but we'll talk about some of those different things, right? So one really important thing is referred to as the regulation of a receptor. And what this is this is either what's called an upregulation or a downregulation, right? So essentially what you can think of these as being like is a cell either increasing or decreasing its sensitivity to a hormone in response to the amount of that hormone that's circulating, right? So, and it makes intuitive sense, or pretty intuitive sense, whenever you think about it in this way. So, meaning, if you have a very small amount or a small concentration, a very low concentration of hormone in the blood, if you want that cell to maintain its sensitivity to that given hormone, do you need to increase the number of receptors on the cell, or are you going to need to decrease the number of receptors on the cell? Hopefully you're thinking you need to increase the number of receptors, right? Because you have such a small quantity or small concentration of hormone, you need to increase or upregulate the number of hormone or the number of receptors on that given target cell, right? And so that's what's referred to as upregulation. So essentially, you are making the cell more sensitive, increasing the sensitivity to a given hormone, right? In response to a reduced hormone concentration, right? So in response to a reduced hormone concentration, right? Downregulation is exactly the same, except that it's exactly opposite, right? So in this case, you have a high concentration. You have a very large concentration of hormone in the blood. And so in order, again, for that cell to maintain its same sensitivity, again, think of the idea of homeostasis for all of this. To maintain its sensitivity, it's going to decrease the number of receptors, right? And again, remember, these receptors are just proteins, right? So we're altering the rate of protein synthesis and thus altering the number of hormone receptors that are present on the target cell, right? So in this case, again, you're altering the sensitivity in response to an elevated hormone concentration, right? So one thing you can think of is how this may affect our physiology clinically, right? So a really good example of this is when you talk about medications that affect the heart, right? So heart rate, blood pressure, things like that, right? Contractility, other things. So one class of medication is called a beta blocker, right? Beta blocker, and these are medications that patients who typically have hypertension, high blood pressure, take in an effort to decrease their heart rate and to also ultimately to decrease their blood pressure, right? So what these hormones are doing is they're blocking beta 1 receptors, right? And if you recall from AMP1 when we did autonomic nervous system, beta receptors are a classification of sympathetic receptors, right? So part of the autonomic nervous system. And so you find beta 1 receptors on the heart, and normally whenever you have something like epinephrine or norepinephrine bind to these beta receptors, you get an increase in the heart rate as well as the contractility. So you get what's called a positive inotropic and chronotropic effects, meaning the heart rate is increasing not only its force of contraction but its rate as well, the rate at which it contracts. So whenever you take beta blockers, right, you are blocking the beta receptor. Okay, so instead of the epinephrine binding to the receptor, now you have the medication binding to the receptor. And so the epinephrine, norepinephrine is not able to bind to it, right? So what do you think? Think about this. What do you think the cell, the heart cells, what do you think they're doing in response to this blocking of the receptor by the beta blocker? Do you think it's going to upregulate the receptor, or is it going to downregulate it? Hopefully you're thinking it's going to upregulate it, right? So we're going to upregulate the beta 1 adrenergic receptors on the heart to increase the heart sensitivity to the epinephrine, norepinephrine that is out there, right? So from the perspective of the heart, it's being blocked, but it wants to bind, quote unquote, wants to bind epinephrine and norepinephrine, right? So now you've increased all of these receptors. So here's a second question, and think about this. What do you think would then happen if you had a patient who had hypertension, okay? They've been taking beta blockers for, several months or something like that, maybe longer, and they have this upregulation of these beta adrenergic receptors. What do you think would happen if they suddenly stopped taking their beta blocker? So they woke up one morning and just said, forget it, I'm not taking this damn beta blocker anymore, and I'm done with it, right? What do you think may happen, right? So to answer that, think about what's already occurred. You have this upregulation of beta receptors. So as soon as they stop taking the beta blocker, now all these receptors are exposed. They still have epinephrine, norepinephrine, circulating. They're still producing it. So what they can end up with is something called rebound hypertension, or sometimes called rebound myocardium excitation. So essentially, whenever you have sensitized the heart to epinephrine, you suddenly stop taking your beta blocker, you get this very sharp and drastic increase in heart rate and blood pressure as well, and it can be dangerous, right? So typically in this type of context with these patients, you would encourage them to, if they are stopping their beta blocker, if their physician or provider has instructed them to stop taking it, they would stop taking it over a period of time. So maybe over a couple of weeks, right? You wouldn't just, cold turkey stop taking it. You would gradually kind of wean yourself off, right? So that has to do with the regulation of receptors on the cell, right? Now you also have interactions of various hormones, right? So you have what's called a synergistic effect, you have a permissive effect, and you have an antagonistic effect, right? So all of these terms, these three terms, synergistic, permissive, antagonistic, refer to the ways in which multiple hormones interact with each other, right? Or their effects on a cell, right? So synergistic, right, this first one is meaning you have two hormones that are working together to produce some effect. So they're both pointing in the same direction, if you will, right? So maybe something like, thyroid hormone and growth hormone, right? They're both stimulating metabolism and growth. They're increasing the metabolic rate, right? Permissive effects is also two hormones pointing in the same direction, but one precedes the other, right? So if you notice in this illustration, one molecule, one hormone is preceding the second one. So first hormone allows the action of the second, right? So in this case, this could be something like one hormone stimulating the release of another. So like, thyroid stimulating hormone from the pituitary stimulates the release of thyroid hormone from the thyroid gland, right? It could also be something like, if you think of the example of the production of milk, right, and the release of milk for a newborn, right? So to make the milk, right, you have to have a hormone called prolactin. So prolactin means pro meaning for or in favor of, and then lactation meaning milk. So prolactin makes milk, or is the hormone that produces milk. And then oxytocin is needed for the release of milk, right? So both of these hormones are interacting, but you need one. In order to release the milk with oxytocin, you need prolactin first to make it, right? And then antagonistic is simply two hormones that have opposite effects. So one hormone causes the opposite effect of another. Really great example of this is insulin and glucagon, right? So insulin is a hormone from the pancreas. It's going to stimulate the uptake of glucose in the blood, right? So it's ultimately going to lower blood glucose levels. Glucagon is doing the exact opposite, right? So glucagon is stimulating the release of glucose from glycogen from the liver, from muscles, and it's going to increase blood glucose levels, right? So in this case, these two are antagonistic to each other. One is doing one thing, one is increasing blood sugar, the other is doing the opposite, it is decreasing blood sugar. So consider these questions, and we will stop here for this part.